Here we are, climate change, biodiversity, and public health, from knowledge to actions. Keep in mind your questions. Please send them in on the platform that you see online. And for those of you here, you can also connect via a QR code. I think eventually we'll put that up, or just the microphone is fine. And keep in mind, please, keep in mind, let's cast this to the world. Hashtag SP France, IANPHI for climate. You can do them all in one, or you can do separately, but please do tweet like a beast. We got to get this word out. Let us begin online with Diarmid Campbell-Lendrum, head of climate change and health at the World Health Organization. Diarmid, are you with us?
I am with you. Can you hear me?
Yes, I can hear you. Good that you're with us. And the WHO. Let's connect these two things, climate change, fighting climate change, and health. How is the WHO helping in mobilizing to get people to connect the two, that it's up to not only the planet's health, but it's my health when it comes to fighting climate change?
Well, first off, thanks very much for the invitation to speak here. Hello to everybody. Bonjour tout le monde. I will carry on in English out of deference. You don't want to hear me massacre the beautiful French language. And in terms of what WHO has been doing on this issue, I'll do two things if I may. One is to say a couple of words about our position on this issue, then run through a presentation quite quickly on the latest science on climate change and health from the IPCC report, which I was pleased to preside as one of the authors on the health chapter. But the reason I think I can be quite brief is that you have already heard many of the headlines already from the excellent panelists that have gone before me, and I think hearing their comments from one of the heads of the IPCC, from youth activists who have been one of the absolute leaders in changing the conversation on climate change, and also my colleague Gravati, is that we are for the first time really starting to make this connection between climate change and health, to see that these things are absolutely interconnected. And in fact, health has some of the best arguments for convincing people of why we need to act quickly to address climate change, both from the threat of climate change to our health, but also the massive public health opportunities that we have, which really mean something in people's lives, and they can be a real motivator for action. And at WHO, we've been banging this drum for a long time, and you will have heard the quotes about us saying this is the greatest public health threat of the 21st century. Acting on climate change is the greatest health opportunity of the 21st century. And just yesterday, on our WHO's birthday, we celebrate World Health Day every year on the 7th of April. The theme that we chose was Our Planet, Our Health for a Healthier Tomorrow. And it's exactly about this issue because it has now risen to the forefront of people's minds and the concern of countries around the world. So,
Diarmid, can I just interject? Can I interject a question real quick here? What comes to mind, because I know your biggest battle the last couple of years was COVID. And how much has COVID made people more aware of the importance of health and connecting that to climate change? Or did COVID distract that effort?
I would say COVID has done both of those things.
Okay.
On the one hand, if you had told us 2 years ago that the world would be willing to shut down major parts of the economy for an extended period of time,
yeah, that was beautiful, wasn't it?
A health threat, even at WHO. Sorry?
That was beautiful for a while, wasn't it? The clean air that you could see, you could actually see Paris beautifully, clearly, and many other cities as well, right?
Well, that's exactly right. It has shown the world that sometimes health does matter more than money, and it has also showed us a glimpse of what we can have if we are able to pursue cleaner and healthier development, and that includes getting on top of the
I'll let you go ahead with your presentation. Sorry, I just had a quick question there. Please go ahead.
Okay. Well. Thanks once again. As I say, I'll try and be as quick as possible. As you say, it's tick, tick, tick for the climate, but also on this program. And just a couple of words on the science itself. I won't dwell on this, but because I think people know the basics, though they know that the projections of the changes in mean conditions for key variables such as global average temperature or sea level rise are extremely concerning. We are on track for something like a 3 degrees centigrade temperature rise by the end of the century, significant increases in sea level. And we also have to remember that many of these things, we're not just talking about what happens in the next few years to the average conditions. For things like sea level rise, this trend will continue. The energy we pump into the atmosphere will continue to raise sea levels over even centuries. And so the projections on the right are the projections for impacts out to 2300. That may seem like a long way away. Most of us are based in Europe. Many of our buildings that we see in our capitals are older than that. And we're talking about the possibility of, in an extreme scenario, if things go wrong, up to even a 15-meter sea level rise. So the threats are absolutely fundamental. We also need to be concerned not just about these changes in means, but it's also often the changes in extremes which kill us. And so we see that extreme weather events such as heat stress that we would currently experience maybe 1 in 10 years under a 4 degree centigrade increase in temperature, which is not completely off the table by the end of the century. We would basically experience those approximately every year. And a 1 in 50 year event is also getting on for that level of probability. So we really have massive fundamental challenges to our public health. And just briefly to summarize some of the results from the most recent IPCC report health chapter, we are already seeing negative impacts across a wide range of health endpoints from the modest amount of climate change that we've experienced up until now. I won't dwell on these, but basically across most of our major climate sensitive disease categories, we are already seeing some level of negative impact. So this is basically the same information put more comprehensively. If you can see that across the different regions of the world, across those major health impacts, there is pretty much nothing which is getting better in terms of the influence of climate change on those. We're already well into the negative across all of these, all of this range. And as I say, that's on a already rather modest degree of warming. If we look at the projected impacts, we're again looking at quite significant increases in things which we're effectively certain about: population exposure to deadly heat waves, and also quite a high degree of confidence on improved conditions for transmission of diseases like dengue, like waterborne diseases and so on, and also emerging risks such as you've heard about in the first panel, the risk of mental health impacts, which we had hardly talked about up until this last IPCC report, is something which is coming through very strongly now. Again, this is a similar message presented graphically. It's basically showing that we're expecting negative impacts throughout these disease endpoints out into the future. The positive message here is that with well-planned and well-supported, well-financed adaptation, we can take care of a significant amount of this risk. So if we're able to put into place more resilient health systems, deal with the underlying determinants of health, poverty, access to food, water, energy, and so on, and make those climate resilient, then we can soak up a lot of the risk. But we also have to be aware that there are limits to adaptation. There are things that we cannot protect people from if climate change continues unmitigated. And this is just, in fact, presenting some results that have already been referred to earlier. That one of the things which we're now extremely concerned about is the effect of climate change on mental health, particularly of younger generations. So large surveys from around the world are showing that across the world, the majority of young people are considerably concerned, and rightly concerned. This is not a sign of irrationality. Being concerned about climate change is now the sane response. And they're also more concerned in cases where they think that their government is not adequately addressing the issue. So we have a duty to protect young people, but we have a duty to showing that we're protecting them as well. So very quickly, there's a large number of things that we can do, basically around strengthening the resilience of health systems, specific things that we can do about providing the basics, water, addressing mental health, looking at integrated adaptation approaches. These are all things which are largely partly under the responsibility of national public health institutes, or at least have a strong role to play. And finally, I just wanted to stress a point which has already been made on the large benefits that we can get from acting on climate change. And you've already heard this from Professor Masson de Mot, that we know that many of the things that we need to do to cut carbon emissions would bring, in fact, massive public health gains. And I'll just quickly show you that graphically. Hopefully you can see this. This is basically what we take as the summary of the final working group of the IPCC, which produced its report, I think, last year. It basically shows we have solutions to climate change across all sectors, the major carbon emitting sectors. Anything shown in blue is actually cost saving. It saves us money to do these things. And some of the biggest gains that we have are in energy. So the shift to renewables actually saves us money now, or a large part of it saves us money now. But we also have important interventions, positive interventions in food systems and in transport systems. And as has been underlined many times, the health gains from this can be considerable. So in transport systems, for example, pretty much everything there is in blue. So everything that shifts us to more sustainable transport, electrification of vehicles, but also public transport, walking and cycling, is actually already beneficial for us, already saves us money. So the final conclusion that I have is we think at WHO that society has basically the most simple choice that it's probably ever had to make. The conclusion from the second working group of the IPCC report is basically we have a closing window in order to act on climate change, in order to safeguard the future of humanity and civilization. So we absolutely need to act on this. On the other hand, one of the conclusions of the IPCC Working Group 3 report is that the health gains, even just considering air pollution, actually pay for the cost of mitigation. So this cost to society is nothing to act on climate change. So that should be a no-brainer, as we say in English. So the final points I wanted to make were just basically suggested roles for national public health institutes for your consideration. One is building a system-wide approach to building health resilience to climate change. And we have a framework for this, builds on the core public health functions, the building blocks of public health that most public health institutes would be familiar with. The second, again, you've heard reference to this, we want to ensure coherence and synergy across health and climate policy. So we think that every nationally determined contribution should include consideration of health. Many countries, in fact, most countries are now doing this, but they can actually improve the quality of those. And then finally, I think the most important one for national public health institutes is to support governments to make healthy green choices the default option. It should be the simple thing to do to either get on your bike and walk and cycle to work, or to have healthy, sustainable, greener diets, rather than the difficult, more expensive option. And with that, I'll just thank you for your attention, and I look forward to any discussion we're able to have. Thank you.
Thank you very much. Thank you very much, Diarmid. Yes, hashtag healthier tomorrow, I see there on your last slide. And also keep in mind, everyone, that hashtag SP France IANPHI for climate, either all together or separately. Please do send it out. I heard a great one from you, Diarmid. It's tick, tick, tick for the climate. That's a good one. So I hope many of you send that out. That would be really great. Thank you, Diarmid. Let's move on to Carlos das Neves, Director of Research and Internationalisation, Norwegian Veterinary Institute. Before I go on, please do keep in mind that we are trying to, for those of you who are having trouble connecting, we have a rainstorm here in Paris, and it's kind of impeding some of our connections. So if you do see a problem with that, we are working very hard on trying to resolve that. Carlos, you're joining us online. Can you hear us? Yes, oh, there you are.
There I am.
Yes. Carlos.
Bonjour, Chris.
Bonjour. Vous allez parler en français or in English?
Are you speaking English or French?
right. Nice to see you. So what is the role of what you're doing now in connecting health with the fight against climate change? Tell us.
Well, I hope I will try to illustrate in a few slides, which I hope are actually a little flashy, how health, first of all, is much broader than just human health, but on how health and biodiversity are affected by climate, and how all this together affect each other, and how one solution that solves one problem can actually solve the problems of all three areas. So that's the story I'd like to tell to you today. And so if I can move on into this presentation, and I hope you can listen. You know, if you're coming out of this, if you're one of the lucky ones that does holidays now in the International Space Station and goes and see the planet from above, it looks beautiful. But for most of us down here, we know we're struggling. And that's why we're talking today about interconnections, about these problems. And the best way to illustrate this, perhaps, is to take you exactly like Hansen and Gretel, go on a breadcrumb trail. And science has been putting these crumbs along in front of us. I mean, we've heard today about the IPCC reports. They've been very, very clear, very good breadcrumbs. There is evidence that climate change is threatening the health and the well-being of us. It's clear that it's a now or never, the time to act. And just last week, we got the message that we have now a good picture of the problem. We can now pave the way to put solutions into place. But a few more crumbs to you. Last year, the IPCC and IPCC joint effort to talk about climate and biodiversity, a very clear message. Human-caused climate change threatens nature and its resources. And myself had the pleasure to join other colleagues around the world in another IPCC report linking biodiversity to pandemics. And while we painted a rather dark scenario of these interlinks, we also gave a very good positive message that I chose to illustrate here. There is a positive conclusion. We have the power to make a change. But let's be honest, we did paint a dark scenario. Here, just one quote. Future pandemics will emerge more often. They will probably spread quicker. They will do more damage. They will affect us, and we need to transform. And we need to transform, and let me now also take you a little trip around a few facts, which I hope for most of you are undisputable. We live in a small little village. We move quicker, animals move quicker, pathogens move quicker, problems move quicker. We're also perhaps much quicker than ever before using the resources that the planet has put at our disposal. Here a picture from the Global Assessment Report 2 years giving us that message. We are using resources too quick, too unsustainably. And these resources are also being affected, by the way, by climate change, not just by our utilization. We need to change. I could also tell you that while new species come and some species departure, and this is part of the evolution, species have been disappearing from the face of this planet quicker than ever before. We are speeding this process. Some of them because of climate change, some of them because of our actions. And sometimes people don't really think about it, but actually, you know, sometimes less species can be a door opener for diseases. We won't go into a lot of examples here, but let me share you one. Hantavirus, which you might have heard of. Studies showing that when the amount of species of rodents goes down, the disease comes up. Or the picture there from a study in Brazil, that when you reforest, when you bring more biodiversity into the ecosystem, antivirus outbreaks go down. So yes, extinction can also lead to disease. But perhaps the most well-known example is land use. We are changing the way we use lands, and we know from studies that up to 30% of all emerging threats are related to land use. And while this picture illustrates what we usually show, you know, a tropical forest being destroyed, here back home in Norway, I like to show this picture. You know, these are Norwegian mountain cabins along the hill. We are changing land use back here. It's not a faraway problem. And when we do this land change, problems happen. And I don't have the time to show you that little infographic, but if you get to look at this later on, it's a really nice picture because it brings you some of the very famous diseases that you've all about heard, the Ebola, Neves, and so on. But it shows that all of them are related to the way we relate to the land. Agriculture, destruction of forests, links to wildlife. These things are behind disease emergence. And I mentioned wildlife because that's another example of climate, biodiversity, and health that get together. We know that a lot of the emerging diseases come from the wilds, but we should also be aware that the way we relate to these species can affect that. And there's been a lot of discussion about the pangolins and COVID, as you're very aware of in the last years, but hopefully now we've learned that the pangolin has no guilty parts on COVID. But let me be straightforward. If this picture illustrates your dinner, you shouldn't really be surprised that you can get something from a wildlife species. And if you engage in wildlife trading, farming wildlife species for whatever purposes, driving species to extinction because of unsustainable hunts, or if you mix your domestic animals with your wildlife, you are asking for trouble, if I can put it like that. So all these are drivers, but perhaps the one that brings us here today as well is climate. And while I have a very nice and healthy polar bear in my back, this is unfortunately another picture of a polar bear. And it illustrates very well the impact that climate change is having in the Arctic. And you know, Arctic, Antarctic, it's because we have polar bears up here in the north, and Antarctic we don't have. It would be a pity to have to change the name of this region to the Northern Antarctic because we run out of polar bears. But climate affects health. And I want to give you actually two examples of affect health without actually affecting human health, to put in context that when I talk about health, is not just about our health. Let me take you to Norway. In 2006, in a very unique hot summer, in the beginning of summer, we had a unique situation where high temperature and high humidity led to, in the course of 1 month, a very typical bacterial disease, that Pastorella, not to overexpress itself. And in 1.5 months, we lost 1/3 of the muskox population. It's a big animal, and it's the last muskox population in the European continent. 1/3 of the population wiped out in 1.5 months due to climate. And if 1/3 is not scary enough for you, let me take you to Kazakhstan, where in 2015, again, due to the combination of high temperature and high humidity, more than 200,000 of the saiga antelopes were wiped out. You know, the picture there on the corner shows, they just dropped dead in the field. It's quite an impressive image. 2/3 of a population, I hope you will agree, threatens biodiversity, threatens the survival of the species, threatens health. And for those working in conservation, the most typical example of a disease that is a game changer, an extinction game changer, is of course a disease that affects frogs. It's a fungal disease that has for the last decades the loss of millions and millions of frogs, of amphibians. It has wiped out of the face of this planet several species. And we know now from science that it's affected by climate, because the fungal is now enjoying more higher altitudes where the weather is now permitting them to act, and for species that were not touched by that fungal to be sustainably, to be infected and to die. So all these examples should be enough, but sometimes for politicians, I need to bring the message home. So to my minister, instead of these examples, I just show you her this map. You know, that's our little green corner of the world, minister. All these little dots are diseases that will either kill humans, spread from animals to humans, or simply kill animals, which are food sources. All of them are today not present in Norway. All the ones I've put a circle are moving up north with climate change. So I'm not talking of a tropical problem. I'm not talking of a Southeast Asia or Amazon challenge. I'm talking something happening right outside our back door. And we need to be active. I've mentioned a lot of dramatic examples. Now I want just to tell you that sometimes we get this to work. And here is just to illustrate that, an example from the Africa savanna. You know, we had a disease that used to kill wildebeests. No wildebeest, more grass, more fires, more fire, less trees, less CO2 capture. Bad for biodiversity, bad for climate, bad for the environment. And then we went in and we vaccinated and we got rid of this disease. The wildebeest were back, they eat the grass, less fire, more trees, CO2 gets captured. An example that's improved biodiversity, improved the ecosystem, mitigated climate change, and probably increased tourism, economic revenue, and the sustainability of local communities. So with this, my message is, if you're looking for someone to blame for all of this, perhaps Homo sapiens sapiens is the guy that is missing on that mugshot there. And we are to blame, but we can also solve the problem. And that means, and I borrow here a slide from IPBES, that if we want to make that sand clock change, we need to look at the nexus between all these compartments: water, food, health, food production systems, climate, biodiversity, diseases. All these things are interlinked. If we understand how they're interlinked, we'll have a chance to make a change. And perhaps I'm a little biased. I'm a big One Health supporter. So the change I would tell you is we need to work in a One Health way. And a One Health way recognizes these interlinkages and recognizing that what you do to solve one problem might solve many. And I'm very happy that actually just last 2 weeks ago, the big international organizations got together and went from the tripartite into the quadripartite, all on board with One Health to make a change. And we need all on board. Because if this is going to work, we need the politicians, the research, the private sector, and the society to engage. And if I'm going to be a little critical, I would say that very often we've had reactive politicians, unconvinced private sector, an uninterested society, and a fragmented scientific environment. COVID has perhaps changed this a little. It's our job to keep it going. And it's our job to keep it going here also in Europe. I know a lot of my colleagues in Africa, they've taken One Health. They've truly embodied this. Here is examples of national One Health plans in Rwanda, in Nigeria, in Uganda, in Ethiopia. Once again, let me be critical. Where is the Norwegian One Health plan? Where is the French One Health plan? Where is the Portuguese, where I come from, for example? We don't have it. So we need to recognize that we need to embody this in the way we work. And I was going to say that you need to focus more on predicting and preventing climate change, biodiversity loss, emergence of diseases. If we do that, we will have less problems we need to detect and less problems we need to handle. And I'm very happy to see, as I illustrate there in the slide, a few initiatives, one out of France, actually Présods, and the One Health program in Europe. We're starting to see a change in the way we work. We're starting to go up this stair rather than coming always down the stair, which is totally wrong. My last message is to say that it's not just about wanting to do this. We need to have the tools to do this. And for that, I would illustrate, not with this slide, I will jump, but with this last one to say governance needs to adjust. And we are now about to discuss the possibility of a pandemic treaty, as well as at COP, we're discussing about the treaties, and at the CBD, we were talking about the POST framework, biodiversity framework. All these initiatives need to bring One Health to their core. It is essential that they materialize change, looking at these linkages. This is how you want to work. Now, if you want to have real solutions, you don't need to listen to me. And my last two slides, 1 minute each, is two very nice films produced by IPCC and IPBES and by IPBES to give you some good ideas of what the solutions might be to solve the problem at the interconnection. Please follow. film on the pandemics. So it's Chris. This is what I wanted to share with all of you today. And merci pour l'attention.
Muito obrigado.
Thank you very much.
A big hand to Carlos. Let's give that to Carlos also for the videos. And thank you for all the breadcrumbs leading us to some solutions. Thank you very much. And we have barely 10 minutes left in this panel, and we do still need to talk to Duncan Selbie, president of IANPHI, which is the International Association of National Public Health Institutes. Duncan, lucky that you're willing to make this a Q&A so we can hopefully finish on time and get some questions in from the audience. Please do send them in, or if there's anyone here in the room who would like to ask, we have a roving microphone for you. Diarmid made, or a little earlier, Diarmid with the WHO said that national health institutes are very much a role in this. And I might just sort of interject one thing is that, I've been in other conferences where we talk about how the importance of doctors are very important too, because who do you trust? Who does the public trust more than politicians, more than lots of people? It's their doctor, yes. Right?
Yes, bonjour. Thank you, Chris. And I find these presentations inspiring. And it's so positive to be having this conversation and for IANPHI to be a co-sponsor, because we think that we can do more in this space. And our work over the last 12 months or so has been, we need to get more prominence in this debate. We need to get climate change as an institutional priority for every National Public Health Institute. The unique thing about IANPHI is it brings together over 100 institutes across the world. And our job is simple. It's to protect and improve the health of the people. It's to build capability, capacity through peer-to-peer support. We are all part of government. We are in our own ways government agencies, from China to Rwanda to Mexico, right across the world. And yet, climate change does not feature on our agendas in the way that we believe they should, and we want to change that. And so we've published a series of measures that we believe every National Public Health Institute should be engaged in. And mainly we want to be in the room in having those conversations with governments so that we can present the evidence and we can be part of the thinking about the solutions.
Yeah, in fact, we heard Carlos just a few minutes ago kind of laying down the gauntlet, saying that some countries have come forth with plans, but others have not.
Yes.
Right? And it's a matter of coordination among all the health institutes, right?
Intersectorally, that no one part of the system can solve this, but working together. So, again, Carlos was speaking about One Health, which is something that, of course, we support. I think there's one, it's about being right isn't sufficient. Having the evidence clearly the science is there. So there's something missing about why we're not converting that understanding into the actions, that we can see that it can be done. But it's not the action by one or another, but by all of us. And so National Public Health Institutes are part of that solution. We are unique in providing or bringing together intelligence and surveillance and science, emergency response. We can produce evidence, we can evaluate policy, but mainly what we want to be is part of that trusted community where politicians, decision makers, wish to have us in the room, where we can understand that there are other factors affecting political decisions, but what we want is for our perspective and the evidence to be in that room and to be wanted in the room. Mm-hmm. We're not think tanks or government, we're not university departments, but we are agents for science and evidence. We want to raise our game as an international association to put climate change right into the heart of our work.
Now, I have a question here. Do you understand English, French, or do
I was going to say I hope so.
Well, no, I can translate, I guess. To increase the resilience of systems, health systems, is a good thing. This is a question coming in. All right, it's more like a statement. But don't we essentially have to intervene in investing more massively in the actions of prevention, of reducing the factors, the risk factors? Let's see here. Hang on a second. Reducing the risk factors about nutrition. Anyway, linking these health policies with fighting climate change. Don't we have to invest more?
Well, yes, we do. I mean, the pandemic has proven the importance of detection, early warning and response. It's shown the importance of surveillance and epidemiology and understanding what's happening. So the importance of joining all this up, that health and wealth are inseparable. And we're talking about, cleaner air through the pandemic, and you were talking about this, but many people have lost their employment. Many people have been pushed into poverty because we need to join this up. And as our earlier speakers were talking, we need to be thinking about equity and about who's being most affected by this. And so when we think about public health, we have to think about how this all comes together and is joined up together, and how we make our choices with an eye to those that are most affected and the poorest in our communities. So yes, we have to invest, but it's been proven time and again, if we invest, we can save. We know that by investing in public health is good for the health of the people, which in turn improves prosperity. And yet this is the hardest thing for governments to. So we'll instead of spending millions, we'll spend billions.
Yeah.
We are not attuned to.
It's reactive
invest
instead
to
of
save, and
instead
this
of
we
proactive,
need to change.
Right?
Yeah. But we want to be part of that conversation. We don't want to be in there just saying you're getting it all wrong. We want to be in there with solutions and opportunities for governments to act individually and together.
Would it be important to demonstrate how public health functions are impacted by climate change?
It's all interconnected. The essential public health functions that the World Health Organization have published were very, all about the actions, adaptations and mitigations for climate change. I won't run through them, but they are all about protecting and improving the health of the people, emergency preparedness and response, good science, research, all these things, working with communities, and crucially, you talked about the importance of trust. These are all part of what a public health institute, if we had perfection in the world, that every country in the world would be capable of.
I guess it's important to demonstrate the risks, the potential costs if we don't take action, and the cost of investing to prevent it from getting worse.
Yeah, I'm normally in conversations about non-communicable disease, like diabetes and cardiovascular disease and obesity, and things that we know would work to improve, not only because we want to help people avoid it, but future costs.
Yeah.
And if we were investing now, what we could not only about improving life and life expectancy, but good health in life, but also future costs. two sides of the same coin.
Okay. We have a couple minutes left, and I'd like to call up a word cloud for those of you who are connected, and maybe we can have a couple of words on that very quickly before we go to the break. Can we put up the word cloud, the nuage de mots? I guess I'll leave this in English since we're doing this in English. After hearing these presentations, what is your priority for action? What is your priority for action? And let's see the word cloud on here, and maybe Duncan, you'd like to comment on that. Maybe you can tell us yourself what is, one priority for IANPHI action to take now.
For national public health institutes, for which I'm the president, is advocacy to get this as an institutional priority for every national public health institute across the world.
Right.
Building capacity. So you said one, okay, but there are others, and peer-to-peer support is a massive part of that. But I think getting it as a priority named for every national public health institute in the world would be a big step forward.
Right, right. Word cloud, can we call that up now? Can we see the word cloud? Okay. Perhaps, now here we go. Orientation, European research. I'm not sure if this is this the one? It's a little bit general. Okay, a couple other actions, immediate actions and messages from IANPHI. What would you like to cast out here that we should be tweeting?
So I think intersectoral collaboration has been said many times about One Health and about all the different mitigations and adaptations, but the critical thing is that we are joining these things up and collaborating as a world on this. We need to invest absolutely, and we need to invest also in our national public health institutes. I'm not sitting here to make that. I'm just saying they are absolutely critical to this.
Do you exchange information among the institutes?
We do.
And to see maybe, I hate that word best practices, but I mean, what works on the ground for maybe in one country?
Absolutely.
And we're going to see some cities later on how this works.
Good examples.
That if that works in one country, why don't we try this in another?
Exactly, and lots of examples of doing that and sharing best practice and learning from each other, the peer-to-peer work that I mentioned, and training. But building capacity, all of these things, and greening our organisations. So leading by example, and every national public health institute publishing how it's getting on with this. And we have established a thematic committee within IANPHI. We're very focused about what we work on. We only have 3, and one of them is climate change and health, and that led to the roadmap, which we've, I think it's been made available to everyone that I'm referring to. But we're also surveying our people about future indicators that we could publish globally that would hold us to account. So how are we doing here? So we have a range of ways of bringing more visibility to this, and the roadmap is to raise that. We want to be more present in this debate. We've got skills, we've got expertise we can bring to bear, but we need to be in the rooms where decisions are being made, because we're wanted in the rooms.
Among those rooms, the doctor's office. Right?
Yeah.
Across Europe, if your communication can wind up in doctors' offices, I think more people will pay attention.
Well, we've made a lot of progress on that in areas like tobacco control and diet, and we've made more progress in thinking about clean air and so on. But what we haven't been is joined up about how this all comes together and how it's. I know these are words, but they are totally and utterly interdependent. And if we can get it right for the health of our people, we can get it right for the prosperity of our world. Yeah. And if we can do that, we can invest more in those that are at the wrong end of this and are at the, are at the margins of this, because the way that we'll really make a difference is by paying attention to those that do not enjoy good health, because they're the ones that don't enjoy good prosperity and climate change and all of that joined up. So what we want to do is to bring visibility to this, and we think climate change is a wonderful way of bringing all that together.
Absolutely. Duncan, thank you very much. Thanks to Diarmid, thanks to Carlos. A round of applause for our three speakers on this panel. Thank you very much. Thank you very much. And thanks to you. We are now on time. Well, we're 3 minutes behind into the coffee break, so we will take on va prendre un pause café.
So coffee break, and we'll be back at 11:30 to start talking about how to improve integration of climate, biodiversity and public health in public policies.